Denise Roche.
Thank you, Mr Speaker. Tēnā koutou katoa. I rise to take the first call for the Greens for the Home and Community Support Payment for Travel Between Clients Settlement Bill. We will be supporting the bill, sir. What this bill does is it basically implements the settlement between the Crown, the district health boards, the providers of home and community-based care support services, and the unions of home support staff, the PSA, the Service and Food Workers Union, over the payment for the time spent by home support workers travelling between clients. And it follows on from a claim that was filed with the Employment Relations Authority by the unions that time spent travelling between clients by home support workers, that should be paid for at least the minimum wage of $14.75 an hour. Essentially, sir, what this is that it is legislation to replace litigation. So according to the regulatory impact statement, this settlement will affect around 28,000 carers, the majority of whom are women who work as home support and work in people's homes. They ensure that people who are frail, elderly, who have disabilities can be looked after in their own homes, and apparently there are around 40,000 of those clients being cared for every year. So, sir, home support carers provide really good value for money. It's cheaper for our health system for people to stay in their own homes than in hospital, and it's better for the client to maintain as much autonomy as possible and just have some help while they are in their own homes. So it's depressing, sir, to say the least, that value for money, that cheaper option than hospital, has been in part achieved by reducing the costs of labour provided by carers to the extent that our minimum employment standards around wages have been breached. So carers and unions, their unions, have known for decades that the work they perform has been underpaid. We knew it in 2002 when I was a caregiver with the Waiheke Health Trust, and even way back in the 80s when I was a carer with Nurse Maud's District Nursing Association in Christchurch. In May 2012, Dr. Judy McGregor, for the Equal Employment Opportunities Commission, reported on basically the exploitation of women who are carers in her report called Caring Counts. And as part of that research for her report, she worked undercover in an aged care facility, and she graphically outlined how physically and emotionally exhausting the work is. And the reason, sir, and she said it too, the reason that there is a very low pay rate for carers is because it's seen as underwork, and it is seen as women's work, and consequently it is undervalued. She made 10 recommendations actually. The first 5 are that the government show leadership to deliver better services for older people, that the woefully low pay rates be addressed, and as a minimum, government-funded service providers in the aged care sector, including home support, that there should be pay parity between people in home support and residential facilities and DHBs, and that there was a fair and consistent travel policy covering actual costs and the time spent travelling between clients, and that there be a commitment to qualifications for staff in the sector and for the employers to commit to it as well, and that there be that the voluntary safety standards, including the home and community support sector standard, become compulsory. There's another 5 as well. But sir, it's a credit to the unions of the people who work as home support carers that in negotiating the settlement that they have attempted to address the recommendations outlined all those years ago by Dr. Judy McGregor. And they've also had to take groundbreaking court cases to try and address those recommendations too. The Service and Food Workers Union, or now E2, and the NZNO taking the case for carer Christine Bartlett Bartlett under the Equal Pay Act, and of course the PSA, Service and Food Workers Union, taking the case for home carers and travel payment and payment for travel time for Tamara Bradley and Jenny Goodwin. I guess this legislation underscores how important the union movement is to protecting and enforcing people's wages and conditions on the job, not just for their members, but for whole sectors. And it's sad that it had to take legal action for the barest of equality to start to be negotiated and to be addressed in this House. The legal case for payment for travel time triggered real discussion and negotiation with the Crown for a fair outcome for home support carers, which takes into account the chronic underfunding of the sector and the need for quality care for those receiving home support, and also around stability for the workforce. I note that as part of this deal, carers won't be able to claim back payment, as would be expected in a legal case. And according to the regulatory impact statement, that back payment for 6 years could be as much as $261 million. And they have foregone that because they want an agreement that will benefit themselves, their clients, the service providers, which are the employers, the district health boards, and the government. They have sacrificed past claims to create a better future for all of them. So the deal the union negotiated, sir, includes, as well as the payment for travel time, payment for mileage to cover the costs of 50 cents a kilometre from March next year and 60 cents from July next year, and that's up from an average of 33 cents a kilometre. It also includes a transition to guaranteed hours of work. It also calls for clients to be allocated in safe staffing levels and training for carers to a level 3 qualification within the first 2 years on the job, and of course pay rates that are better than the minimum wage, where qualifications are recognised on the pay scale. These are all incredibly important aspects of the deal. The transition for guaranteed hours of work means an end to 0-hour contracts for home carers, and it means there'll be stability around their earnings. They'll be able to plan their lives. And hopefully this will also start to address the horrendous staff turnover in the sector, which I read is as much as 40%. And it makes sense to invest in rewarding carers who've achieved their qualifications so that there is an incentive to upskill. The government, sir, can't continue to underfund home support work at the level of the minimum wage, and it's time to recognise the current and growing level of skill needed, because carers, they're dealing with increasingly complex needs. So it's going to cost about $38 million a year, and it's good to see that the Crown has allocated this to DHBs, who will send it out to the service providers, who will pass it on to the carers themselves. So we support this bill. We also acknowledge that this will pave the way for ACC-funded carers to also start to see some equity in their payments. This deal is starting to make an impact right now. The PSA Journal last month had interviews with 2 carers who talked about the increase in their take-home pay as a result of finally being paid their travel time. Thank you, sir.